discuss about Raynaud's phenomenon. In Raynaud's phenomenon, we will discuss about definition, so types, stages and etiology, so complications, clinical features, surgical management, nursing management and medical management, then so diagnostic tests. So first we will discuss about the definition. It is a condition that can cause discomfort as the blood supply to the fingers and toes becomes reduced in cold temperature or any emotional stressful conditions with the change in color of the affected area. So it mainly Raynaud's phenomenon means in extreme cold temperature or any stressful condition, blood flow to the finger and the toes becomes reduced, then it changes its color. First, so it will affect the numbness in the fingers and toes and tingling feel in the our fingers and toes. So now we will discuss about Raynaud's phenomenon stages. So first stage means wild stage. It is the initial stage in which the blood flow will reduce to the fingers and toes. In first stage, so blood flow to the fingers and toes will reduce. That time, so white color will appear in our fingers and toes. Then blue stage, it is the second stage. So lack of oxygen in the blood, then our fingers and toes turns to bluish color. Then red stage, it is the last stage. Last stage when the blood flows returns. So when blood flows returns, that time so our fingers and toes becomes red color. So now we will discuss about types of Raynaud's phenomenon. So first type is primary Raynaud's phenomenon and second one is secondary Raynaud's phenomenon. First we will discuss about primary Raynaud's phenomenon. It is the most common from the Raynaud's phenomenon. So it is the most common type in the Raynaud's phenomenon. Then it is called idiopathic. So there is no specific cause in the Raynaud's phenomenon. So it is a mild. So it is not that much severe. It is a mild condition. Then no need to take the treatment. Now secondary Raynaud's phenomenon. It is generally more complex and serious than primary type. So it is more complex than the primary Raynaud's phenomenon. Then it causes the autoimmune disorder. Autoimmune disorder means our own immune system mistakenly attacks the healthy cells. Then it causes the Raynaud's phenomenon, secondary Raynaud's phenomenon. So now we will discuss about etiology of the Raynaud's phenomenon, means causes. So first cause is autoimmune disorder, means our own immune system mistakenly attacks the healthy cells, then it causes the Raynaud's phenomenon. Then emotional stressful condition, so our fingers and toes becomes cold, that time circulation will decreases. So injury to the hands and feet, so any injury for the hands and feet, then also Raynaud's phenomenon will occur. Then atherosclerosis means so plaque storage in the arteries. So that idiopathic means unknown cause. Then cold temperature, in cold temperature so blood circulation will decreases. Then frostbite means in our hands and feet becomes too much freeze or very cold temperature. Now we will discuss about risk factors. Being women, so compared to men, women will affect the most Raynaud's phenomenon. Then age between 15 and 30, so age gap between 15 to 30 years, so Raynaud's phenomenon will occur. Then people who live in colder climates, so people who are living in cold climates, so Raynaud's phenomenon will occur. Family history. In family history, so our grandparents or so parents are suffering from Raynaud's phenomenon. Other family members also can chances to get the Raynaud's phenomenon. Then exposure to cold. So exposure to cold means in cold condition our fingers and toes becomes cold. That circulation will reduces that time. So Raynaud's phenomenon will occur. Now we will discuss about clinical features. First, so what are the signs and symptoms occurs in the Raynaud's phenomenon? First, cold fingers and toes. So first, what will occur? Our fingers and toes becomes extreme cold. Then color will changes. So when Raynaud's phenomenon will occur means our skin color will changes white, red and bluish color. Then numbness in fingers and toes. So numbness will occur in the fingers and toes. So now we will discuss about the complications. First, ulceration formation in the fingers and toes. So while circulation will not So then tissue loss. So circulation will reduce, means tissues will get in the fingers and toes. Then Tissues will dead means gangrene will occur in the fingers and toes. We will discuss about the diagnostic test. First one is history collection means, so for the patients we have to collect complete history, then we have to collect from their parents. So then physical examination means, so from head to toe we have to collect the physical examination. Then blood examination, which type of bacteria, virus is really causing means, so we have to do the blood examination. Then microscopic examination of the fingernail tissues. So we have to collect the fingernail tissues and we have to do the microscopic examination. Now we will discuss about the management of Raynaud's phenomenon. First, so medical management. So medical management in, so vasodilators will administer to the patients. It relaxes and widening the blood vessels. Then it increases the blood flow to the feet and fingers. Then beta blockers, it also helps the blood vessels and relax and open up the improve the blood flow to the fingers and feet. So it helps to the blood vessels relax and opens up to improve the blood flow. So it helps to the blood flow to, so it helps the blood flow to the fingers and feet. So vasodilators and so beta blockers will administer in the Raynaud's phenomenon condition. Now we will discuss about the surgical management. In surgical management, sympathectomy will conduct. It is the surgical procedure in which the small incision is made on the affected area to strip away the tiny nerves around the blood vessels to control the opening and narrowing of the blood vessels. So in sympathectomy, so in affected area, small will conduct. So small incision means small cut will do. Then so strip away the tiny nerves means, so in small incision that blocked surgical management. In surgical management, sympathectomy will conduct. It is a surgical procedure in which the small incision is made on the affected area to strip away the tiny nerves around the blood vessels. It controls the opening and narrowing of the blood vessels. So in sympathectomy, so in affected areas, small incision means small cut will do, and it will remove the affected nerves around the blood vessels and it increases the blood flow in the fingers and toes. So now we will discuss about the nursing management. In nursing management, so we have to educate the patient to avoid extreme cold temperature. Then so we have to educate the patient to keep the body warm, and so we have to educate the patient to wear the gloves and socks. Then we have to educate the patient to moisturize their body. It will prevent the dryness, and we have to advise the patient to do regular exercises. It will improve the blood circulations in the patient's body.